See, Miss Eva Garvin Amfrans, right, joining from Barcelona, or but I see San Francisco behind you.
That's correct. Yes, one can dream big. Yeah.
That's right. So,
Not that
thank
Barcelona is not beautiful, but
yes, no, 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 thank you for joining. I looked up the website of your company, and I was impressed with the mantra. You can't prevent what you can't predict. So, could you just explain to the group what prediction is all about and how you use artificial intelligence to support anesthetic decision making in real time?
thanks so much for the opportunity to share today about prediction. I start by excusing myself. I'm an engineer. I'm not a physician. So for most of the physicians in the call, you will think I'm talking very simple terms, but simple terms allows me to raise money for venture capital. So allow me to explain this in the most simple way. So prediction, as Dr. Egbe was explaining before, starts with an anesthesiologist. Actually, he goes to Stanford to do his PhD on mathematical modeling. And he believes that anesthesia should not be population based and reactive, but it could be individualized and proactive. And this was really like the unmet need that he wanted to improve. And he then went to MIT to do some AI techniques to be able to bring that predictive capabilities into anesthesia. I'm going to explain very simple how prediction works. So if most of you, or hopefully not all of you, have gone through an operating room as a patient, and if you remember, by your side, there's the anesthesiologist. The anesthesiologist, uh, one and most important role is the safety of the patient. And when they roll you into the operating room, they will connect you to different sensors. It depends on the complexity. And today that we're talking about resource limited settings, depending on the resources of the countries, is very different, for example, in rural Spain that in a big city in Spain also. But they will connect you to some sensors, some in your front, some in your chest, some in your arms. And the whole objective of connecting you to sensors is that the anesthesiologist has different machines, yes, where they're going to be during the hours that your surgery takes place, they're going to be observing your vital signs. They're going to be observing how your brain is conducting under anesthesia, how your heart, how your lungs. So you probably know also this, that most of the times the anesthesiologist is reacting to alarms of these medical devices that are in the operating room. And the moment that the anesthesiologist reacts to an alarm, you as a patient are already suffering a complication of anesthesia. So how could we change this? So basically what we have done is we've spent many years in operating rooms collecting data, and we have created predictive models. These predictive models are then built into software, hence why the engineers come also into play. And what it does is imagine same procedure for you as a patient. Yes, you're entering the operating room, you're connecting to different medical devices, but all the information of all those medical devices are now connected to our medical device. Yes, so as a patient, you're not having to suffer any other intervention, just that the anesthesiologist is seeing all the information integrated, but not only integrated, we're giving 10 minutes ahead of time of visibility of potential complications of anesthesia. What are the most common potential complications? Hypotension, respiratory depression. Are you too sedated or too little sedated? Are you going to suffer pain? And as we're giving this individualized, because we are collecting what's happening to your vital organs in real time, then the anesthesiologist can adapt your level of anesthesia before those alarms go off. So that's why we're saying we're doing predictive and individualized anesthesia. And that's the really innovation we're bringing. We're super proud because we're talking to all the big medtech companies, Medtronic, Philips, General Electric, and no one has a solution like this because no one has spent years and years collecting data to build predictive models. We can talk later about how you build correctly with predictive models and AI in such a high risk environment. But I think with this, I gave a little bit of a clear explanation of what we do at Prediction. Thanks for the opportunity.
Thank you. Thank you. I'll come back to you because I have a number of follow-up questions for you. But let me take this moment to also welcome Ms. Salami, CEO at Kindly AI. Again, I was intrigued by your company's mantra, lead AI, don't chase it. and you're in the space of adopting AI to educate individuals, educate organizations, and scale to enterprise spaces. So, could you just tell us how you think AI itself can be leveraged to personalize and improve healthcare education and training?
Absolutely. So, hello, everyone. Good morning, good afternoon, maybe evening. Um, yeah, so when I think about AI I think of it obviously as a tool and just it's an enablement. It really starts most importantly with understanding what it is, how it works, and ultimately what it cannot do, right? Because there tends to be a lot of hype around all of the great things that it does, essentially. And so when I would kindly, which is pronounced kindly, what we spend a lot of time doing when we talk about fluency is how do you elevate above the technology itself and get back to what the things that are most important. And it starts when we think about healthcare, it starts actually with the patient, right? Where's the friction? And the core of my background is in pharmaceuticals. And so really looking around that value chain of where value gets created, which is helping patients understand what the therapy options are, helping providers understand ultimately whether or not the therapies are the right ones for their patients, understanding how to move patients from not just having a script in hand, but navigating the prior authorization and all of the friction in the provider's office to what needs to be actually done to ensure that patients stay on therapy, because that's really where value comes, right? And the real outcomes, health outcomes, actually manifest. So when I start thinking about what it means to personalize in healthcare, it's going beyond just compliance. It's making sure that we are building these tools that are really adaptive and fit into the workflow of the healthcare providers. I think that is super critical. Um, I already know there's a lot of friction that exists in just operating your day-to-day work. So how do we make sure that it fits naturally and the intelligence, the data that you leverage, the data that trains the models are actually appropriate for the use cases that we're talking about? And then ultimately, I think there really needs to be truly looking at both sides of the coin, not just the providers, but also the patients and what the patients need. So personalization goes beyond just what the providers need, but ultimately also how we tell the patients and help the patients understand categorically how the therapies work for them, the behaviors we expect of them, and ultimately how they navigate the most difficult areas in their lives.
Thank you, Ms. Salami. So I see we have Ms. Shimada. Welcome. Uh, Good to see you. I introduced you earlier, but I'll just pose the question again to you. That just given the amount of work and experience and deep expertise that you have in studying the financial and economic impact of digital health technology introductions into low resource communities, can you just sort of discuss with this group um, in terms of understanding the clarity around introducing AI into healthcare? You know, how should countries, especially low resource countries, be thinking about either digitizing their healthcare system, or if they've already done that, scaling, adopting and scaling AI? What key considerations should guide those decisions?
Thank you very much, Doctor. I'm sorry I had my webinar time wrong on my calendar. I'm sorry for joining a little bit delayed. I think these points might have already been mentioned, but as we talk about AI specifically, in terms of adapting or considering to adopt AI in healthcare, especially in lower resource settings, we need to first understand what the problems are that healthcare systems or healthcare providers might be facing, and whether a technology such as AI is the right choice to solve that problem. I say this because I see some people not confusing, but really jumping on the buzzword of AI very, very quickly before considering whether it is the right solution or not, or it's at all possible to adopt AI, because of the underlying data collection systems may not be there, or the data set itself is not coming from that specific context to be able to leverage AI in solving whatever the problem that they might be facing. So before people, before I recommend using AI in healthcare settings, I think the question that we have to ask first is, what problem are you facing currently, and whether artificial intelligence is the right solution to solve that problem or not. And then of course that the chain reaction is that, okay, if how to solve the problem and what technology is possible or appropriate, and then we can talk about how to evaluate the outcomes because of the adoption of whatever technologies that you might be adopting to solve that problem.
Oh, thank you. That really is a strong point, because even in my system here at Mayo Clinic, where obviously we're not strapped with resources, where we've scaled AI as more broadly, we always come back to that question: what problem are we trying to solve? Because otherwise, you have a ballooning of projects, and before you knew, things are out of control. But can you talk a little bit about the required infrastructure? What would be the basic infrastructural needs to even begin to contemplate this question? I'd imagine electronic health records, some sort of integration, that kind of thing.
So I'm speaking from the perspective of resource limited settings. Of course, US is very, very different in terms of connectivity, internet coverage, internet speed, and that sort of thing. In resource limited, we tend to assume that these things exist, or these things work as well as we would like to. But when we think of implementing a technology such as AI, we need to really think about whether, so the ultimate goal is to expand access or expand equity, or improve equity. But then, of course, the internet access to fast internet or internet coverage or 5G, 4G connectivity is not always equitable. So in terms of foundational infrastructure, we of course have to look at outside of the health sector and really work across sectors to make sure that these fundamental infrastructures, such as telecommunication infrastructure, internet connectivity, electricity, that sort of thing, are there. And health sector alone cannot solve these fundamental or foundational challenges.
Thank you. So, Ms. Afference, I'm going to go back to you. You kind of tantalized us with, how do you go about actually developing a model? And it sounds like you used machine learning to develop your model. So if you can talk through with a guest, how you go about doing that. How do you get together your development model? How do you validate it? And also then talk about how you actually use it to improve patient safety and outcomes in anesthesia, and how relevant that could be in low resource countries. It's a lot of questions packed in one.
No, thank you very much. And I'm also trying to build on the comments made before, yes, because I could not agree more. It all starts with what's the unmet need. And even in Spain, and I think we find this in many other countries, in the European Union, we have only half of the anesthesiologists that we need, yes. And we know that this when I talk about anesthesiologists, OBGYN, we will talk about any specialty, we will have half of the doctors that we need. And we also know that demographically, this will never be sorted out. Yes, it's impossible. Just we have aging population, we will have less and less young doctors coming through the ranks. So we need to sort this problem through technology. We also know that the population is aging, and aging population for most of the diseases is at high risk population and with comorbidities. So the biggest concern of an anesthesiologist is a frail person with a lot of comorbidities. That is a high risk patient. So that was like the unmet need. And then the other kind of ambition of the team is, why are we doing individualized and preventive cancer care and we do not do individualized and preventive anesthesia care? Yes, and there's 300 million surgeries every year worldwide. So clearly there is enough number of surgeries that this has a big impact. So let's start. I'm always concerned by these AI companies that start by